Hello and welcome to today's review. Today we are going to look at a past paper, NCK past paper. That was paper 4 in 2008. But based on the today's standards, most of these questions will be found in paper 2. Okay, so let's get right into it. First question, we have the characteristics of a feature of a paranoid personality disorder is. Alright, so we have, of course, 9 groups of personality disorders, and we can try and review some of this one. Option A, someone having lifelong social withdrawal and discomfort with human interaction. This one will be more of schizoid personality, right? So this one is more of schizoid nature. Someone with intense and chaotic relationship, that is a borderline personality and not paranoid. And D, someone showing signs of dependence on others for emotional support and reassurance. That is a dependent personality, right? So the best option for us here is long-standing suspiciousness and mistrust for people. This is a person who will be diagnosed with paranoid personality disorders. Guys, a link will be popping up. You can check on the 9 different types of personality disorders. Let's go to question number 2. Basing on Clark's rule, the adult dose of a certain drug is 500 milligrams. The dose for a child weighing 15 kilograms will be. Alright, when using the Clark's rule, we normally take the weight of the baby, we divide it by the 70. That is the standard weight of an adult, right? That is in kg, and then you multiply it by the adult dose. So that is 15 divided by 70. All right, multiply by 500, right? Okay, that gives us around 107, right? Looking at our option, we don't need to overdose our baby. The correct answer, close to what we need, is 100 milligrams. Question number 3. A possible nursing diagnosis for patients suffering from organic disorders. Remember, organic disorders tend to address cognitive and psychomotor impairments. Looking at our option, maybe starting with option D, high risk of injury and related to extreme hyperactivity. This is more of a mania or ADH, right? ADH or delirium, right? Number C, altered thought process related to withdrawal into self in evidence by difficulty in concentrating. We could suspect schizophrenia, depression, or dementia in this case. Self-care deficit related to withdrawal, regression, panic, anxiety, perceptual and cognitive impairment. Ladies and gentlemen, think of depression here, anxiety, schizophrenia, or bipolar. The best nursing diagnosis addressing and cognitive and psychomotor impairment is the high risk of trauma related to impairment in cognitive and psychomotor function, right? And this is the best answer for us here. Question number 4. The major developmental tasks at age 6 to 12 years according to Sigmund Freud are. Alright guys, looking at option number 1, initiating feeling of affection for another person. This will mainly occur in the anal phase, right? In the anal phase around 1 to 3 years, right? This is where this is likely to occur, right? Okay, so this is about that between 1 and 3 years, the anal phase. Identifying with the parent of the same sex, achieving a sense of self-confidence by learning. This is more of the phallic phase. And phallic phase occurs at what stage? About 3 to 6 years. Okay. forming relationships with members of the opposite sex, receiving recognition from significant others, peers, and acquaintances. This is more of the genital phase. Genital phase occurs at between age 12 and 18, right? I think the best option for us here is repressing of sexuality, forming I'm sorry, forming relationships with the same sex, right? And I think that will be okay for our case here, right? In this case, let me just scroll down. All right, so this is the best option for us here, right? Remember, in Sigmund Freud came up with the psychoanalytical theory in which he proposes several stages, starting with the oral stage, which happens between age 0 to 1. We have anal phase, which is 1 to 3. Then phallic stage, which is 3 to 6 years. Then the latent stage, which is 6 to 12, all right? 6 to 12. And in this, our case here, it is the latent phase. Okay, then you have now the genital, which is around 12 to 18, adolescence, then affection going on, right? So I think that is what we needed to do in this case, right? So let's move to the next question. All right, that is question number 5, right? Yes. So the most common side effect of electroconvulsive therapy are, okay, guys, looking at number first one, permanent memory loss. This is not so common, right? Not so common in our case. Fractured bones and dislocated, it used to be very common before the use of the muscle relaxants. But nowadays, muscle relaxants are normally used, so it has reduced such cases, so it's no longer a threat. Myocardial infarction, it can happen, but this is very rare, right? Very rare. Remember, we are looking at the most common side effect, right? And the best option is option D, which is talking about temporal memory loss. So it affects our short-term memory, and somebody will be confused, that feeling disoriented for a short period after awaking from that procedure, right? That becomes the problem. Right? Number 6, action research is conducted with the primary intention of, number A, applying and testing a theory, right? Applying and testing a theory, this you could be talking of applied research, right? Okay. Collecting and analyzing data, this is just data collection, right? It's just data collection. Deriving scientific knowledge to be used in finding solution. This is more of basic or pure pure research. The best option for us here, action research is normally conducted with the primary intention of solving a specific, immediate, and significant problem. The way people behave and believe can best be investigated by, all right, guys. When looking at quantitative, this is all about numericals. They answer questions, how many things are, what is the problem? That is what is being answered here, right? Experimental design, these are control experimental designs. They don't explore. Qualitative study design, that is the best. But descriptive, this one aims to describe subjects, right? So the best option for us here is the qualitative study designs. The percentage of burns in children whose buttocks are burned is, okay, guys, we normally use the rule of 9. So the modified rule of 9s, it states that the head and neck accounts for about 18%, each arm accounts for about 9%, each leg 14%. We have anterior trunk 18%, posterior trunk 18%, of which this 18% is where buttocks are included, right? So when you look at it, you find that the buttocks normally makes up around 5% of that. The control group in experimental trials normally receive Well, in experimental studies, we have two groups. We have the control and the experimental group, right? So the experimental group normally receive the active treatment, while the control groups receives the placebo. So the best correct answer for our case is the placebo. The functions of educations include, all right, education has several roles, of course. Looking like at option number one about social integration, innovation, and custodial function. These are the major roles of education. Remember, custodial, when you talk about social integration, this education normally helps us integrate diverse social groups, which normally promotes sharing values, and that becomes a key role. Looking at innovation, education helps us to be more creative and to encourage and foster critical thinking. So this is also very important. About custodial function, although this is not so commonly talked about, custodial functions include things like just making or keeping the children in a very safe place, right? So option A is the best option for us. Looking at option number B, social secondary socialization, yeah, that is part of the roles of education. But talking about reduction of stress, this is more of a psychological problem. So this is not actually primary role of education for that case. Talking of C, where it's talking about cultural transmission, yeah, that one we can also accept as a role, but protection of citizen, conditions of services might not be a direct role of education. Maintenance of social order, that could be okay. What about provision of humanitarian aid? Is that the role of education, guys? No. An independent variable in research is the one that, all right, so we have several variables in research. So the first one influences other variables. This is too general. As we know, independent variable and dependent variable both can influence, right? Generating discrete data, not really. I think the best option, which is an independent variable, is this one that can be manipulated by the researcher. Remember, both dependent and independent are observable variables, right? Yes. The main events of educational objectives are educational objectives. Well, we normally look at the Bloom's taxonomy, which talks about knowledge, skill, and attitude. When talking about here, you see the criterion makes this option wrong, right? The criterion looking at this one, act and goal, right? Performance, condition, standard. Remember, standard performance is what learners are expected to do. Condition are the circumstances, right? Where the standard is the criteria for accepted performance. So whatever describes the objective educational goal is option number C. A lesson plan is a guide to what should happen in a. Alright guys, looking at all these options, a lesson plan is a written description that is normally used in learning and teaching situation just to guide the facilitator, who is the teacher, to systematically present the subject matter in a more logical, interrelated, integrated way such that learning is reinforced and enhanced. Looking at these options, the best option is option number B, teaching and learning session. The methods of teaching attitudes. All right, guys. Teaching attitudes can be so challenging, So in doing so, we normally give information to shape attitudes, like giving facts about a disease, for example. We can also give examples or models to shape attitudes, like advertising a goal or experiencing to just shape attitudes. Like you could give an opportunity to work in a hospital that can work on the attitude. We can also do the discussion to shape our attitude, for example, by sharing our own opinions that can help shape our attitude. We can also embrace the role plays, for example, playing the role of a doctor, a nurse, a patient as a nurses, that helps us teach attitude. So looking at the options that we have, we will agree that maybe option number B can be more of the correct answer. About role modeling, which you have mentioned, a small discussion, simulation. Remember, role modeling normally involves demonstrations, right? While small group discussions enhances sharing of perspectives. Simulation will reflect on the attitudes on the real life scenarios, right? So these other ones may not be able, right? Okay, number 15. Non-projected teaching aids include, all right, so these non-projected teaching aids, what are they? They do not require projection equipments and they are typically used in face-to-face, when using face-to-face teaching. Whereas projected, at least you now require that. Looking at the options that we have, of course, we can go with the first one, right? The flip charts, the handouts. We also have pictures, flip charts, posters, handouts, panel boards, which are classified as non-projected. Like here, you could see here for the option number B, kaleidoscopes, whatever, all these are projected forms, right? That makes it wrong. Here the films, the projected, so posters are only the non-projected. Chalkboard pictures, they're okay, but what about overhead transparency? Projected aids include overhead transparency, that is the use of projector, the kaleidoscope, the films, the video cassettes, the slides, and so on and so forth, right? Okay, number 16. Measles contributes to malnutrition because it causes, if you try to reflect on some of the signs and symptoms of measles, of course, it can cause fever that can even be greater than 40 degrees Celsius. It causes cough, it causes running nose, inflamed nose, and the cochlix, right? Remember the cough, the cohesion, the conjunctivitis, all these are some of the cardinal signs of measles, right? So it majorly affects that system. So looking at our options, like maladaption, it's okay, vomiting, vomiting, yeah, maladaption, maybe not, pneumonia, it can be a complication of measles, right? In our case here, look at stomatitis, conjunctivitis, stridor. Yeah, this could be some of the complications that you have. Ear infection, right? Dysentery, this one is more of bacteria than whatever. So, ladies and gents, what majorly contributes to this complication of as in how measles contributes to malnutrition is because they cause diarrhea, which does not allow enough time for nutrients absorption. We have high fever, so the metabolic rate is going to really increase, so the nutrients will not be sufficient to sustain that. Mouth ulcers, it will also uh, interfere with the processing of the food as you get. So option number D is the best option for us here. The classifications of ear problems. Ear problems. Look at the ENT guys, right? So looking at these options, I think the best option for us should be A. Why do I say so? If you're looking at option number B, this one is not comprehensive. Not comprehensive, right? They have just talked about the mastoid, acute, all this is like middle ear infections only. Option C, this one also does not encompass broader classification. You can just use trachea, tympanic, or middle again. Option D has classified foreign bodies in the ear as an infection, right? It's a condition. So option A is the best option for us. Clinical features of meningitis in a child aged below 2 years include, all right, guys, you have to avoid the classical signs and symptoms of meningitis in adults, right? Like positive cardiac sign, neck stiffness, positive this one, neck stiffness. These ones will not be typical. They will not be there in an adult, in a child, right? But for an adult, it's okay, right? That may be the best, the easiest way to rule out them. But remember, in children, we normally have fever, drowsiness, convulsion. This startled expression, this could be irritability, right? Irritability. So that is what is all about that one. So these are the major symptoms that normally appear in adults will not be present here, right? Okay. For question number 19, you indicate whether the following statements are true or false. An abstract of research article tells the reader about the research summary. Yeah, this is true because the abstract normally provides a brief summary of the research. The abstract is used by the researcher for source of funding. This is false. All right. We all agree, of course, abstract is normally included, but it's not primarily designed for that purpose, right? For us to get the source of funding, it will require an outline of the project, the budget, and the significance. For question number 20, you match drug classification in A with the drug choice in B, indicating the correct numbers. We have anxiolytics and antipsychotics. All right, when you look at these drugs, guys, anxiolytics, antipsychotics. Antipsychotics, I think they are the easiest. You can see Halodol, Stelazine, and Lagactin, right? All right. Anxiolytics now you can have them here. Yeah, here, right? Yes. So let's try and rule out these other drugs. Like if you could look at the first option, and the first Labrium, Cerox, these are normal. The first two drugs are anxiolytics, right? But this one makes it wrong because what is this class? This class is an antidepressant, especially the TCA, right? Guys, a link will be popping up on antidepressants. You can look at the different types of antidepressants, including the TCA, tricyclic antidepressants. Option 4, Attain, of course, this is anti-Parkinsonic drug. Levodopa, this is a drug used to treat Parkinson. What about Nadlil? Nadlil, this is a monoamine inhibitor. Of course, it's also a type of antidepressants. State 5, responsibility of psychiatric nurses. According to military, we have so many roles. Outline 5, nursing intervention for a person with suicidal. We have several. Describe the physiology of urine formation. All right, we have tried to describe. Explain 3 rules of home treatment for a mother with breastfeeding child suffering from diarrhea. Of course, you have them. Have to continue breastfeeding, give oral dehydration solution, and provide appropriate age feeding. 5, non-probability sampling methods. We have several of them, right? Convenience, purposive, snowballing, quarter, and expert. 5 phases of research. We have several of them. Identify the research problem, do research, literature review, formulate hypotheses, research design, data collection. Explain 4 principles of learning. All right, when you're looking at learning, we have several principles, of course. You have to ensure there's active learning, there's clarity, there's mastery of content, individualized learning, and motivation, right? 5 reasons why students are evaluated. There are so many of them. Master Ken is aged 10 years or 10 months and is admitted to your ward suffering from severe right? So we have some severe signs of severe pneumonia. We have the gaseous exchange between the alveoli and the blood capillaries, the management of this particular patient, right, till discharge. 55-year-old lady who never had a child with her late husband is brought to the psychiatric unit suffering from severe depression. So you're supposed to at least give some signs and symptoms of such. You also differentiate between reactive and endogenous depression and manage the patient till discharge. Right? Okay, guys, that marks the end of our presentation on this paper. Remember, the topics for paper 2 are as highlighted.